ഹലോ ഫ്രണ്ട്സ്, പുതിയൊരു വീഡിയോയിലേക്ക് എല്ലാവർക്കും സ്വാഗതം. 1000 MCQ സീരീസിൻ്റെ പാർട്ട് 17 ആണ് ഇന്നത്തെ വീഡിയോ. അപ്പോൾ വീഡിയോയിലേക്ക് കടക്കാം. ഫസ്റ്റ് ക്വസ്റ്റ്യൻ, വിച്ച് ഈസ് കോൾഡ് ആസ് ദ വെൽക്കം സൈൻ ഇൻ ലേബർ? ദ ഓപ്ഷൻസ് ആർ ഫാൾസ് പെയിൻ, സോഫ്റ്റനിങ് ഓഫ് സെർവിക്സ്, ലൈറ്റനിങ് ആൻഡ് ഓൾ ഓഫ് ദ എബോവ്. And the answer is lightening. Lightening means the process of baby settled or lowering into the pelvis is called lightening. Lightening is welcome sign in labor. Next question. Monitoring the budget process is known as. The options are evaluation, audit, counseling and directing. And the answer is audit. The next question. Guiding and directing efforts of employees and other resources to accomplish to start work aspects is termed as. The options are organization, supervision, coordination and planning. And the answer is supervision. In the next question, excessive amount of cyclic bleeding at normal interval is termed as. The options are menorrhagia, epimenorrhea, metrorrhagia, dysmenorrhea. And the answer is menorrhagia. Remaining options would be metrorrhagia is uterine bleeding at irregular intervals. And next is epimenorrhea. Epimenorrhea is too frequent menstruation occurring at any time, but particularly at the beginning and the end of the menstrual life. Dysmenorrhea is pain associated with menstruation. That is, menstrual pain is dysmenorrhea. Next question, which of the hemoglobin level at any time during pregnancy is considered as anemia? The options are below 10 g/dl, below 11 g/dl, below 9 g/dl, and below 7 g/dl. And the answer is below 10 g/dl. The next question, fetal movement count should be noted from. The options are 20 weeks, 32 weeks, 28 weeks and 14 weeks. And the answer is 28 weeks. The next question, short cord syndrome means umbilical cord length is less than. The options are 45 centimeters, 40 centimeters, 35 centimeters and 20 centimeters. And the answer is 35 centimeters. Next, abnormal cord length നോക്കാം. First, normal cord length is 50 to 60 centimeter, averagely 55 centimeter എന്ന് പറയാം. Less than 35 centimeter is defined as short cord and may lead to fetal distress, placental abruptio and prolonged labor. And more than 80 centimeter is defined as long cord. Higher occurrence of cord around neck, cord around body, cord knot, cord prolapse and cord compression. അപ്പോൾ normal cord length is 55 centimeter, short cord is less than 35 centimeter, long cord is more than 80 centimeter. The next question, destructive operation in which thoracic and abdominal content are removed in order to promote expulsion of dead fetus is. The options are evisceration, pleodotomy, decapitation and craniotomy. And the answer is evisceration. Remaining destructive operations നോക്കാം. First one is pleodotomy, means dividing of one or both clavicle with an embryotomy scissor to reduce a biacromial diameter in shoulder dystocia with a dead fetus. Next one is decapitation. It is severing of fetal head from trunk. Next is spondylotomy. It is division of the vertebral column. And fourth one is craniotomy. Craniotomy is perforation of the fetal head. അപ്പോൾ ഡിസ്ട്രക്റ്റീവ് ഓപ്പറേഷൻസ് ആണ് ക്രേനിയോട്ടമി, ഡീകാപ്പിറ്റേഷൻ, ക്ലീഡോട്ടമി, സ്പോണ്ടൈലോട്ടമി ആൻഡ് എവിസറേഷൻ. ദ നെക്സ്റ്റ് ക്വസ്റ്റ്യൻ, ഇൻ ഫോളോയിങ് വിച്ച് സ്റ്റേറ്റ്മെൻറ്റ് ഡസ് നോട്ട് ഫുൾഫിൽ ദ ക്രൈറ്റീരിയ ഓഫ് ന്യൂറോസിസ്? The options are insight is present, personality is preserved, behavior is grossly disturbed, the contact with reality is present. And answer is behavior is grossly disturbed because communication and language are not affected by neurosis. Then psychosis and neurosis differences നോക്കാം. Psychosis is more severe than neurosis. First one is insight. In psychosis, insight is absent and neurosis, insight is present. And in psychosis, judgment and reasoning is impaired, and in neurosis, judgment and reasoning is intact. And in psychosis, reality contact is lost, and in neurosis, reality contact is present. And delusion usually present in psychosis, delusion absent in neurosis. True hallucinations usually present in psychosis, and true hallucinations are usually absent in neurosis. Change in personality may be there in psychosis, and change in personality is usually absent in neurosis. This is all about psychosis and neurosis. In the next question, spoon-shaped nail is suggestive of, the options are endocarditis, trichinosis, iron deficiency anemia, and long-standing hypoxia. And the answer is iron deficiency anemia. In the next question, most abundant neuroglia cell in the CNS is, the options are astrocytes, oligodendrocytes, ependymal cells, and microglia. And the answer is astrocytes. Different types of neuroglia cells നോക്കാം. Central nervous system ഉണ്ട്, peripheral nervous system ഉണ്ട്. Central nervous system, astrocytes, ependymal cells, oligodendrocytes, and microglia. And in peripheral nervous system, satellite cells and Schwann cells. First one in CNS, astrocytes. It is most abundant neuroglia. Astrocytes maintain blood-brain barrier and provide structural support, regulate iron, nutrients, and dissolve gas concentrations, absorb and recycle neurotransmitters from scar tissue after injury. അപ്പോൾ ആസ്ട്രോസൈറ്റ്സിൻ്റെ കേസിൽ ബ്ലഡ് ബ്രെയിൻ ബാരിയർ ഓർക്കുക, പിന്നെ മോസ്റ്റ് അബണ്ടൻ്റ് ആണെന്ന് ഓർക്കുക. Next is ependymal cells. Ependymal cells line ventricles, that is brain and central canal, spinal cord, to assist in producing, circulating and monitoring cerebrospinal fluid. CSF producing cells are ependymal cells എന്ന് ഓർക്കുക. Next is oligodendrocytes, that is myelinate CNS axons and provide structural framework. Myelin sheath producing cells are oligodendrocytes. Last one is microglia. Microglia remove cells, debris, waste and pathogens by phagocytosis. Phagocyte, that is immune cells in the brain ആണ് microglia, that is phagocytosis. Last one is peripheral nervous system, satellites and Schwann cells. Satellite cells are protective cells and Schwann cells are myelin sheath of axon of PNS. The next question, the rate of drug absorption is greater in the options are large intestine, stomach, gallbladder and small intestine. And the answer is small intestine. The next question, which of the following IV fluids is the best for treating a severe case of cholera? The options are normal saline, Ringer lactate solution, 5% dextrose solution, and 10% dextrose solution. And the answer is Ringer lactate solution. In the next question, Norplant, which is a contraceptive method, contains, the options are norethisterone acetate, ethinyl estradiol, levonorgestrel, and spermicide cream. And the answer is levonorgestrel. നോർപ്ലാന്റിനെ കുറിച്ച് ഡീറ്റെയിൽ ആയിട്ട് നോക്കാം. നോർപ്ലാന്റ് എന്ന് പറഞ്ഞാൽ 6 തീപ്പെട്ടിക്കൊള്ളികൾ വലിപ്പത്തിലുള്ള സിലിക്കോൺ ക്യാപ്സ്യൂൾസ് ആണ്. അത് ഇൻസേർട്ട് ചെയ്യുന്നത് വുമൻസിൻ്റെ അപ്പർ ആമിലാണ്. അത് ചെറുതായിട്ട് പ്രൊജസ്റ്റിൻ റിലീസ് ചെയ്യുന്നുണ്ട്. 5 ഇയർ വരെ കോൺട്രാസെപ്റ്റീവ് പ്രൊട്ടക്ഷൻ നൽകുന്നുണ്ട്. ഇറ്റ്സ് ഓൾ അബൌട്ട് നോർപ്ലാന്റ്. ദ നെക്സ്റ്റ് ക്വസ്റ്റ്യൻ, ഡെത്ത് ഇൻ ഇന്ത്യ ഈസ് രജിസ്റ്റേർഡ് വിത്തിൻ ഹൗ മെനി ഡേയ്സ്? ദ ഓപ്ഷൻസ് ആർ 14 days, 21 days, 7 days, and 28 days. And the answer is 21 days. The next question, which is the most appropriate time for IUD insertion, intrauterine device insertion? The options are during or within 10 days of menstruation, about the midst of cycle, just before menstruation, at any time of menstruation. And the answer is during or within 10 days of menstruation. The next question, the chance of acquiring HIV infection following needle prick is, the options are 3.0%, 0.3%, 5%, and 0.03%. And the answer is 0.3%. The next question, the branch of psychology which is related with the diagnosis and treatment of mental disease. The options are educational psychology, comparative psychology, clinical psychology, and applied psychology. And the answer is clinical psychology. In the next question, emotional evaluation of self-worth is the options are self-concept, self-esteem, self-realize, and self-identity. And the answer is self-esteem. The next question, science of collection of numerical facts and data is known as, the options are demography, statistics, census, and none of the above. And the answer is statistics. അപ്പോൾ ഇത്രയാണ് ഇന്നത്തെ വീഡിയോ. അപ്പോൾ വീഡിയോ ഇഷ്ടമായെങ്കിൽ ലൈക്ക് ചെയ്യുക, ഷെയർ ചെയ്യുക, സബ്സ്ക്രൈബ് ചെയ്യുക. അപ്പോൾ അടുത്ത വീഡിയോ ആയിട്ട് അടുത്ത ദിവസം കാണാം. താങ്ക് യു ഫോർ വാച്ചിങ്.